A study published in the New England Journal of Medicine says Indiana's HIV outbreak was preventable. Sarah Whitmire reports on its findings.
Health officials diagnosed more than 190 people with HIV since the outbreak started last year. Most of them live in Scott County and caught the virus from sharing needles they used to inject a powerful prescription painkiller called Opana. Part of what made the outbreak so different is it occurred in a small rural community, and the study cautions it could happen elsewhere. The circumstances underlying this HIV outbreak are not unique to this community, the study says. It points to a lack of health care, substance abuse treatment, and HIV testing as factors that contributed to the outbreak. Before the number of HIV cases in Scott County skyrocketed, there hadn't been free HIV testing offered in the community since a Planned Parenthood location closed in 2013. Indiana State Health Commissioner Jerome Adams disputes that in a statement released last week. HIV testing has been available in Scott County since well before the outbreak and has never been limited to one facility, Adams said in the statement. The unfortunate reality is that research has shown repeatedly that people with substance abuse disorder often do not seek out medical care. All the testing facilities in the world won't identify an outbreak if people don't come in.
We actually went down in our public health spending to $12.40 per capita, which is significantly lower than other states.
The study also points to syringe exchange programs as a key component in limiting future outbreaks. It says such programs can reduce the risk of an HIV outbreak by as much as 56%.
I think our syringe exchange program the legislation was set up to fail because of the lack of resources attached. And yet you have counties that have no resources working very diligently to develop this harm reduction strategy.
Until last year, syringe exchange programs were illegal in the state. Legislators passed a bill that allows counties with high rates of hepatitis C to declare a public health emergency and request state approval for a syringe exchange. These programs offer clean needles and a variety of services, including referrals to drug treatment and HIV counseling. Representative Ed Clear says while Indiana's bill was a good compromise, it's reactive.
We're waiting for something bad to happen and then reacting to it. And I think the study very clearly shows that syringe exchange should be in the toolbox for prevention, for preventing the sort of outbreak that occurred in Scott County.
So far, 5 counties have state-approved syringe exchange programs, and more are in the process of requesting them. Once a county gets the green light from the state, work begins to find funding. The state still bans funding for needle exchange programs. The study warns that although it's challenging, eliminating the funding barrier is critical to stopping the spread of HIV and preventing future outbreaks.
We know what an important role prevention plays, and we know what a lack of prevention there was in Scott County, and unfortunately what a lack of prevention there still is in most Indiana counties.
So it is a public health crisis, and we're happy that it seems that the feeling across the country is to move it from a criminal problem into a public health problem, to go back to pre-Harrison Act 1916 criminalization of drugs and start really treating it like the public health crisis it is. So it'd be nice to have the dollars to be able to grapple with it.
For Indiana News Desk, I'm Sarah Whitmire.